So we have the SonoSite Edge ultrasound machine for our game day ultrasound at Fremantle Dockers, and we find the system incredibly useful for management of soft tissue injuries as well as diagnosis of injuries. In particular, one of the major utilities of the SonoSite system is being able to visualise soft tissue injuries, particularly of the upper limbs and also the lower limbs, very clearly. Okay, we're looking at Michael's acromioclavicular joint. And the difference between injuries in AFL players and, say, the general population is that in addition to inflammation in the lining of the joint, they also get problems with the capsule as well as some of the adjacent ligaments. And so the utility of the ultrasound in doing injections in this region in AFL players is that we can get a beautiful injection of both the AC joint, the joint capsule and the adjacent ligaments to give them optimal pain relief. So rib injuries are quite a common rib and chest wall injuries are quite common injuries in football players because of the high overhead marking and also because of the bumping that's allowed during play. And so often we get injuries of the ribs in players or the costal cartilages which need diagnosis and treatment. You can see the rib just here, that's the echogenic white line is the rib, and you can see the lungs moving underneath. And as I come forward towards the costochondral junction, so the white rib turns into black costal cartilage. And you often get injuries of the ribs at around the end of the ribs or at the costochondral junction or of the costal cartilages themselves. And the SonoSite ultrasound allows us to obtain really beautiful images of these soft tissue injuries and bony injuries in patients or players that have sustained a chest wall injury. And we can go longitudinal on the ribs as well and have a look at the costal, look for rib fractures by examining the contour of the rib, that white thick line that we can see, and also the costochondral junction, looking for step or contour abnormalities of the costochondral junction as well as the cartilage itself. And we can also have a look at the soft tissues on either side and surrounding the rib, so the chest wall muscles. The system also allows us to perform match day diagnosis, so we're able to ultrasound the patients or the players in the treatment rooms and make a quick assessment and tell the coach whether the player is suitable to get out onto the field again. And if that's the case and the patient needs some treatment, we're able to intervene at the time to allow them to perform at their best. And that's usually with a local anaesthetic injection. And the main utility of having the ultrasound in that situation is that I can guide the needle into exactly the right place and reduce the risk of complications from injections. For example, around the chest wall and in the shoulder region where there are a number of vessels, or the lungs that we need to be careful of when we're performing injections.